Hi everyone, welcome to my YouTube channel. In the last video, which was, I know that it was a bit lengthier, I spoke a lot about the different types of dementia. Today, I'll be posting a bit of information about the risk factors of dementia. Now, it's very important for us to actually keep our brain healthy. There is absolutely no age factor as such to start. You should, of course, sooner, the better, but yet there's absolutely no delay. So if we start from today, it still is going to benefit our brain. Now, we all worry a lot about different, organs in our body. Particularly, we worry a lot about the heart because we know that it pumps blood inside our body. But many of us don't even focus much on keeping our brain healthy. That's only because we don't see it. Of course, we don't see the heart either. But the fact that there are many people who talk a lot about the healthy, aspect of heart, we go ahead and then start eat food that reduces the risk of getting heart disease. We go ahead and then do a lot of exercise. We also go and then constantly go to a doctor and then check the function of our heart and things like that. None of us actually go to a psychiatrist or a neurologist to check how our brain works, because we know that, okay, I'm able to see, I'm able to think, I'm able to eat, I'm able to actually mingle with different people. So why should I even worry about how my brain functions, right? But that's not how it works. Because there are so many risk factors that are basically associated with getting dementia. Now, there is an organization called World Health Organization, which you might have heard about. Now, there are lots of recommendations that have been made by the World Health Organization. While these recommendations, are quite long and lengthier, and are also well, intended. There are many aspects in those recommendations which have not been scientifically proved, but yet it's definitely going to help us, because the healthier the brain is, the risk of getting dementia is very, very less, minimal. Now, I'll be sharing a few points about why it is important for us to go through these risks. There are things that everyone can do basically to reduce the risk of dementia, getting dementia basically, and it also delays the onset of the symptoms. Now, we of course, there are different ways in which we get dementia, but dementia in most cases is not inherited, because if you have a family history, it increases the potential, but it does not guarantee that you will get dementia. So that's a good news basically. Now, the risk of having dementia actually increases as we age. Of course, there are also early, there is a childhood dementia. There is also mid-age dementia, and the varieties which they have been discovered. But predominantly, people get dementia only after the age of 60 plus. Now, important risk factors are the same as those of heart. If you want to keep our heart healthy, it's also important for us to keep our brain healthy. So what, like high blood pressure, like hypertension, diabetes, high cholesterol, obesity, smoking, and physical inactivity are some of the factors that are associated with uh, you know increased risk of getting dementia. Now, they also say that higher level of education and doing mentally stimulating activities. Like, for example, if you are a voracious reader, and if you are a speaker, if you actually go and then learn a lot of music and art, and are into a lot of mentally stimulating work, like you go into the field, you do a lot of research, you go and then do nature walks, you actually go into the nature field and then do a lot of mind stimulating work, the risk of getting dementia is very less. Now, because there is something called as cognitive reserve, which I have mentioned in my previous video as well, whereby cognitive function is basically maintained in the face of brain pathology. Now, a lifetime approach to dementia risk reduction is absolutely needed. That's one of the intentions why with which I started posting these videos, because it is important for us to actually approach this from a lifestyle angle rather than looking at it only from a dementia from a disease angle, because there is absolutely no cure. As I said earlier, it's not like you actually take a pill and then probably after 15 to 20 days you actually get cured of dementia. It's not like that. And as I said, it also the symptoms, while the symptoms start showing very late, but the effect on the body actually starts much earlier. So it is important for us to actually focus from a life style point of view. Now, I will be going through some of the important recommendations that have been made, and I'll quickly finish it. Now, physical activity that's been recommended by the World Health Organization, as I said earlier. Now, physical activity should be recommended to adults with normal cognition to reduce the risk of dementia. But this beat, people with normal cognition or high cognition, that doesn't matter. Physical activity is very important for all of us. The next one is tobacco. Now, tobacco should not be taken at any point in time at all, because it not only increases the risk of getting dementia, but it also brings down the cognitive capability of the human brain. And of course, when you actually stop smoking, it also comes with other benefits, like it doesn't affect your lungs, and then you can actually you will not contract cancer and a lot of other associated risks that tobacco comes with. And of course, nutrition, you need to actually eat a lot of good food. Of course, there are quite a few recommendations that have been made by World Health Organization. If you are interested, you can write to me or just post a comment. I will definitely send that to you. Alcohol is also something that you shouldn't actually be using, because alcohol use also causes a lot of disorder, mental disorder. Now, it also brings down the cognitive capability, and it also increases the risk. And also, not consuming alcohol brings in with a lot of other associated benefits as well. Now, weight management, of course, you need to do regular exercises. That's very important. You also make sure that your high blood pressure isn't affecting your health. So which means checking your blood pressure on a regular basis also is very important. So which means you can do associated therapeutic exercises like yoga, walking, cycling, doing a nature walk, and spending a lot of time in reading, which brings down your blood pressure a lot. Then social activity is something that's been recommended by WHO as well. If you are a kind of an introvert, while we really don't want to impose a change, but it's recommended that you start having your external social activity. It can be among your social group, like if you are a reader, you can actually meet a group of readers. If you are a sports person, you can actually meet a group of sports person. If you are a physically if you are into weightlifting and bodybuilding and things like that, you can actually form a group of people who are interested in that. Like this, you can actually make and form a group in which you can meet them on a regular basis. That will give you and increase a lot of social activity possibilities as well. Now, there are people who go into depression too due to various reasons. If you have lost some loved ones in your family, or if you have any breakup, or if you have lost your job, or if you are so worried about your capability that you actually get into a lot of depression and things like that, that can also cause a lot of issues later. So it is important to seek counseling and also medical intervention at the right stage. And being depressed doesn't solve any issue. So it's important for us to get out of depression as soon as possible by going and then meeting a psychiatrist and taking the right medicine, right counseling at the right time. And this is also something that I have experienced, because my mother suffered from hearing loss. That's also something that you can actually try with, because if you stop if you develop hearing loss issues, there is a possibility of you creating your own world, and that can also cause a lot of depression because you're not able to participate in a group. You probably are not invited. You probably are not given importance, and that can cause a lot of issues in your mind as well. So if you have hearing issues, it is important for you to go and consult an ENT specialist, and then make sure that you solve the issue, or if it requires you wearing hearing aid, you should start wearing that as well. And you don't have to feel bad about it, because after all, if something doesn't function, like for example, I'm wearing glasses, because I can't clearly see without glasses, so that doesn't put me down, that doesn't lower my skills, it doesn't got anything to do with your skills at all. So, and particularly when we have medical support and medical intervention in every possible way, I think we should make best use of that as well. So those are some of the risk factors that are associated with getting this dementia. I'm sure that you found this to be useful. So in case if you have any questions about the risk factors that concerning dementia, please write to me at mjkrishnan76@gmail.com. I'll be happy to answer all your questions. And if at all I don't know any answer to any of your questions, I'll definitely make sure to guide you to approach somebody who will be able to help you to answer your question. So thank you so much for subscribing to my YouTube channel. I would request you to share this video and also share my YouTube channel to as many people as possible who will definitely benefit from this simple gesture which I have taken. Thank you so much.